Thank you so much for staying with us. Let's begin in Cross River State, where lawmakers are now taking steps to confront poor sanitation issue, holding a public hearing on a bill aimed at ending open defecation. Our reporter Tina Akweke has this story.
Open defecation remains a major public health concern in Nigeria, attracting the attention of global bodies like the United Nations and the World Health Organization. Recent report estimates that about 48 million Nigerians, nearly 1 in 4, still engage in the practice. In Cross River State, a coastal state with many riverine communities, the effects are especially severe, as water sources used for drinking and bathing are often exposed to contamination. Against this backdrop, the Cross River State House of Assembly Committee on Water Resources and Sanitation held a public lecture on the Open Defecation Prohibition Bill 2025. The hearing drew strong participation from government agencies, stakeholders and community representatives who are key to driving awareness and compliance at the grassroots. Lawmakers say the bill, which is undergoing legislative scrutiny, is designed to tackle health risks linked to open defecation, promote behavioral change, and strengthen sanitation standards across the state.
The essence of this is to solve some very big health challenges that open defecation has caused in our society. So from today, Cross Riverians should know that in the nearest future, open defecation is no longer allowed. It is an offense. When you are caught anywhere defecating openly, it is a big offense, and there are penalties, as clearly spelled out.
Hearing are expected to refine the bill before final passage, bringing Cross River State closer to a law that safeguards public health, the environment, and human dignity.
Today is a very good day for all of us. It is an attempt by the House of Assembly, the first of its kind in the country, at least to pass a bill that will prohibit open defecation, in the states. So this is really something we really have to welcome. It's a very good development.
As deliberations continue, lawmakers say efforts are now focused on stamping out open defecation and improving public health across the state. Tina Akweke, TVC News, Calabar, Cross River State.
TVC News, Tina Akweke joins me on News from the States. Tina, this is a problem Nigeria has battled for years. Set the context for us. Why is Cross River State particularly vulnerable when it comes to sanitation challenges, and how do you think the government is looking to tackle it?
Well, Ibrahim, Cross River vulnerability really comes, down to its geographical location. The state has many riverine and coastal communities where people rely heavily on rivers and streams now for drinking and bathing. So when open defecation happens around these water sources, the risk of contamination becomes higher. So from what comes out from the public hearing, the state government is trying to address this and to ensure that legislation stating that the proposed bill will also push for better awareness and community, level engagement, and also push for more education on sanitation.
Right. So from the discussions you observed, does this bill lean more towards enforcement and penalties, or education and behavioral change, or a mix of both?
Absolutely. From my observation, the discussion is clearly a mix of balance from both the legislature and the stockholders. There was this agreement that enforcement has a role to play. But many speakers made it very clear that education and also behavioral change are just as important as the bill. So the both were merged in that event. And the best note to take home is that the state government is pushing for prohibition of open defecation.
Right, TVC News, Tina Akweke, thank you so much for the update. Thank you. Now let's take you to Kogi State, where the governor, Usman Ododo, has called on traditional rulers to be more vigilant